This is QTV News coming to you live from our studios on Caribou Avenue, and I am Ashma Uba. Thanks for joining us. Here are the main news headlines. As investigation continues into the cause of the acute kidney injury outbreak in the Gambia that has killed dozens of young children, we spoke to Dr. Abubakar Jah for his views on the situation. Authorities at the Department of Livestock Services and National Livestock Owners Association have confirmed the outbreak of cattle lumpy skin disease in the country, which has led to the death of some cattle. The Ministry of Trade, through the Enhanced Integration Framework Strategic Secretariat, is hosting a high-level forum for public sector officials on how to access trade-related climate change financing. The Gambia's Minister of Tourism and Culture, Hamad Nkeba, has expressed his disappointment at the $20 airport security fee to be paid by travelers and visitors at the Banjul International Airport. Those were the main headlines. Now the news in detail. Now, as investigations continue into the cause of the acute kidney injury outbreak that has killed dozens of young children in the Gambia, we spoke to Dr. Abubakar Jah, consultant urologic surgeon and CEO of Sharaf Medical Center, about the situation. Ajibintu Drame reports.
This current outbreak of acute kidney failure has been linked to the E. coli bacteria and possible toxicity from syrup paracetamol. It was detected in late July and affects children aged between 3 to 7. Over 35 cases were reported in the country as of early August, with 28 deaths equivalent to more than 80% fatality rate. Most cases were reported from Western 1 and 2, the Lower and Central River regions.
It is a very serious problem when you have children dying in their tens in this small country. Then it's a big problem.
As the investigation continues, samples of the drugs that the children took have been sent to toxicology labs in Senegal and Ghana for testing.
This situation, I will not say it is out of hand, but I can still say it is still not under control. Okay, there are actions being taken to put it under control, but it is still not under control, and still we have children coming down with it. And we still have a massive response going on to try to get materials for the treatment of these children, and also to try to investigate it further so that we can finalize what really the problem is.
The children suffered symptoms including an inability to pass urine, fever and vomiting that quickly led to kidney failure.
And most of the ways are just unfortunately because of hygiene problems. We all remember that recently we had these floods. On HealthLink on your TV, we talked about the floods and the fact that these floods can predispose for people having these fecal-oral infections. And that was even before this outbreak came. And this outbreak has now come, and most of the tests now have proved that that is actually the cause of it. So how do we prevent it? How we prevent it is just what we said, is just to increase our hygiene.
Dr. Jah advises on preventive methods and implores parents to stay proactive and vigilant in observing their children, particularly during the rainy season.
Food that is not cooked, we make sure that we wash them properly, very well. If we have water source that we are not very sure of, we make sure we boil the water before drinking it, especially before even giving it to children. A lot of these children that are dying now, it's because they have waited for days at home. Diarrhea, vomiting, fever for days. And on top of that also, some of them have not passed urine for days before going to the hospital. So it is unimaginable that a parent can keep a child in the home for even let us say 24 hours without making urine, and you still keep the child for even longer.
In a press release, the Ministry of Health implores and encourages hand washing, especially in integrated management of neonatal and childhood infection clinics, and suspended the intake or use of syrup paracetamol. Ajibintu Drame, QTV News.
Authorities at the Department of Livestock Services and the National Livestock Owners Association have confirmed the outbreak of the cattle lumpy skin disease in the country, which has led to the death of some cattle. Omar Pejala spoke to them, and this is the story.
The cattle disease was first reported in Sando district in the Upper River region since the beginning of the year. It continues to spread to all regions of the country, affecting only cattle. The president of the National Livestock Owners Association, Ibrahima O. Jallow, said the disease is having a serious effect on the cattle farmers with significant income losses. He appeals to the authority to help prevent the further spread of the disease.
This is a disease that affects the body of the animal. By looking, you can see a lot of spots on the animal, and then at a point it disturbs the animal to death. And then actually we're receiving a lot of mortality. When we talk about a lot of death, most of the animals that are affected, especially the young ones, is lead to their death. And this is a loss to the farmers across the country. And I think it's a concern to the farmers, it's a concern also to the Gambian people, and it's a concern to the authorities in the Gambia.
Jallow further stated that the consequences of the disease are also devastating at national level because of the substantial economic losses in milk production, reduced skin quality, and restriction of trade and movement of cattle.
The government of the Gambia almost provide about 100,000 doses to give out to this animal. So we are appealing to the Gambia government and to the authority through the Ministry of Agriculture to them to help us to provide more, or to any other donors, so that the animals in this country will able to receive this vaccination to save from this particular disease. Because when this disease emerge and then it increase into the animal, actually it will reduce production of cattle in this country, and also reduce the income for the farmers in this country.
Dr. Abdou Sise, Director of the Department of Livestock Services, said his department is making all efforts to contain the disease. He added that the Epidemiology and Information Unit of the Department of Livestock Services are collecting the data obtained from the field.
Lumpy skin does not have a cure per se. There is no, specific drug that is known to treat lumpy skin disease. It's a viral disease, and many viral diseases don't have a cure. All that is done to deal with them is to put up measures to prevent them from occurring.
Dr. Sise also reveals that the mortality rate of the lumpy skin disease is very low, as only a few cattle are dying due to the disease. He, however, says his department has not relented since the beginning of the outbreak, and they have already rolled out vaccination throughout the regions to prevent and contain the spread of the disease.
We are working on getting more funds to buy the vaccine. The vaccine is available commercially. If we want today to get it from Senegal, we can easily get it. So it's about getting the funds now quickly approved, and then we would continue responding to outbreaks wherever they may occur in the country.
Dr. Sise further dispelled rumors currently circulating, suggesting that eating the meat and milk of infested cattle can transfer lumpy skin disease to human beings. He explains that lumpy skin disease cannot be transferred to human beings through consumption of cattle meat or milk or direct contact with infected cattle. Although the origin of the disease is yet to be established, officials believe the risk of imminent infection from neighboring countries is very high. In the current situation, veterinary services are confronting the disease for the first time, as they are unfamiliar with the disease clinical presentation, its transmission methods, and the available prevention and control options. Reporting for QTV News, I am Omar P. Jallow.
Now, the Ministry of Trade, through the Enhanced Integrated Framework Secretariat, is hosting a high-level forum for public sector officials on how to access trade-related climate change financing. The forum is meant to foster the participants' knowledge on the procedures and processes of accessing trade-related climate financial to implement policies and strategic addressing climate change. Mahmoud Lamin Choi report.
Gambia is one of the world's least polluting nations, contributing less than 1% of global emissions. However, like many developing countries, it faces the devastating impacts of climate change. Our national climate change response requires, among other things, access to trade-related climate change finance from international funds. Lamin Queen Jame delivers the opening remarks on behalf of the Trade Minister.
It is envisaged that this dialogue will particularly focus on raising the knowledge base of public officials on the procedures and processes accessing trade-related climate change financing for the Gambia.
International funds such as the Green Climate Change Fund, which is the world's largest climate fund, has a critical objective of helping developing countries raise and realize their nationally determined contributions towards low emissions and climate resilient developments. The process to access financing from the Green Climate Fund can be lengthy and complicated. A study published this year in the Journal of Global Environmental Change found that most countries, the majority in Africa, with the highest vulnerability to climate change, have missed out on finance for adaptation through the Green Climate Fund. By Madi Sise is Director of State-Owned Enterprises at the Finance Ministry.
One of the challenges we face in Gambia is that formulating a very good bankable project is very difficult. As NDA, we've received a lot of project proposals from the private sector and from the public sector. But most of these project proposals, you're looking at 2 pages, 3 pages, and it's not really very well formulated. And the GCF, the systems, first of all, you need a lot of data. A lot of data. You have to do a lot of research in order to begin formulating your project.
The Green Climate Fund is a critical element of the Paris Agreement and is mandated to support developing countries. This forum is organized through the Enhanced Integrated Framework Secretariat, a development partner of the Trade Ministry. Annette Samuwimba is the Secretariat's Deputy Executive Director in the Gambia.
As we had, providing information to be able to access this funding is one of the key challenges. So the EIF stands ready to contribute to these efforts to enable countries to access their resources.
The Minister of Environment and Climate Change, Rohi John Manjang, reiterates the impact of climate change on the Gambia despite its low contribution to carbon dioxide emissions. The Climate Change Minister praises the forum and calls for a swift response to tackle the climate crisis.
We are demanding for climate justice. Those that cause the highest emission should voluntarily again take up the lead to make sure that they support us as much as possible. So we are saying that be responsive according to your capacity and your capability. Gambia is taking the lead to respond according to our capacity and our capability.
The Permanent Secretary of the Trade Ministry, Lamin Damfa, outlines government's commitment to addressing climate change-related issues by using trade-related policy and instruments. This forum is implemented with knowledge and experience sharing featuring both local and international experts and participants. Mahmoud Lamin Chai, QTV News.
That story will lead us to a commercial break, but when we return, we have more local news stories for you. Do stay tuned.
Hello and welcome to US Embassy Gambia Today, a podcast brought to you by US Embassy Banjul. This weekly podcast will feature leaders and our partners in the Gambia. Join us every Wednesday as we broadcast these informative episodes from our American Corner studio at Africell in Bundung. We are on Spotify, Google, SoundCloud, and Apple Podcast. You can also follow the program on our Facebook and Twitter pages at US Embassy Banjul. US Embassy Gambia Today, bringing the Gambia and the United States closer.
COVID-19 is real. Get vaccinated against COVID-19. The vaccine is safe and effective. The vaccine is readily available in any health facility, free of charge. Currently, there are 3 different types of vaccines, namely Johnson & Johnson, Pfizer, and Sinopharm. Hand washing with soap, when done correctly, is critical in the fight against COVID-19. Wash your hands frequently, including every time you enter the home or office. Avoid shaking hands with other people. After you cough or sneeze, and before you eat, use soap and water or an alcohol-based hand rub. Clean frequently touched surfaces, frequently with chlorine or alcohol solution. Remember, no one is safe until we are all safe. This message is brought to you by the Ministry of Health and the Gambia Country Coordinating Mechanism with funding from the Global Fund to fight AIDS, TB, and malaria. For more information, please call our toll-free number 1025.
Welcome back. If you're just tuning in, you're watching QTV News with me, Ashma Oba. Now, the Gambia's Minister of Tourism and Culture, Hamad Nkeba, has expressed his disappointment at the $20 airport security fee to be paid by travelers and visitors at the Banjul International Airport. In an exclusive interview with QTV's Aliou Cisse, he said the decision is bad for the tourism sector. Here's an excerpt.
I can tell you that I hate this security tax. I don't like it. It's there, but I don't like it. But since government have signed a contract, we can understand the situation. A contract is gone into. We have to live with it for the time being until government decide otherwise. But it's an obstacle, particularly the mode of payment at that airport. I have to be honest with you. This is my honest opinion about this. I don't hide my feelings for anything that I feel I don't believe in, and I don't believe in that airport tax the way it's been operated on, and the entire connoting that we are competing. We are in a competitive market. You don't increase the cost of your market for an airport tax like that. That's not my belief. As far as I'm concerned, it is not the best for us. It is affecting, yes. If the payment was inside ticket, you can even understand that. People will not notice it. But the way it is collected, it's adding a lot of problems for some of our clients, for some of the tourists that comes here. Even Gambian, not only tourists, for any other passenger for that matter. So for me, I'm against this airport tax. Well, you know, I cannot tell you. You see, let me tell you, government works differently. Every ministry have your own way of doing things. The ministry that implemented it has a reason of implementing in terms of security. Well, you go and find out. You go and find out which ministry implemented it. You will get to know. They have a reason to say we need this for security reason. But tourism, who are bringing in tourists, would say it's not good for us. So government works like that. You have interlinkages that sometimes may not match together. It happens. But for us, for me, what concerns me most is not only about the cost, but the method in which the collection is done. You understand what I'm saying? If this was in the airport, it would not be in the air ticket, it would not be as visible as it is. So that's the position I have on this. You see, Sierra Leone have cancelled theirs. Sierra Leone have cancelled theirs. And these are all countries competing in the same market with us. You know, so we know that it's not good for our tourists, for our tourism. It's not. That's my view about this.
The Edward Francis Small Teaching Hospital received donations of drugs and medical equipment on Wednesday from two charity organizations, Open Hands Gambia and Save Our World. More in this report by Ansumane Sonyasi.
The EFSTH is the only teaching and main referral hospital in the country and serves as the last resort for patients with the most severe conditions. Over the years, the hospital, like many other medical establishments, has been confronted with challenges. Hence the importance of such interventions by members of the public or organizations. Open Hands Gambia and Save Our World are two charity organizations which have supported the hospital over the years. Dr. Borang Gorenjai and Miss Adele Sok are members of Open Hands Gambia. They say the organization is a non-profit organization formed by Gambians who contribute what little they have to support the hospital.
What the public is seeing here is just some of the boxes, right? The rest are in storage because we are of transportation difficulties. Right. We're not able to bring all the boxes out.
Fabulous work that really you're doing, and we know that the hospital cannot do what they're doing by themselves.
The organization donated cartons of gloves, face masks, sanitizers and aprons for hospital staff. Abdullah Jallo is the national chairperson of Save Our World Gambia chapter. His organization is donating over 24 cartons of drugs and medical equipment to the EFSTH. He explains what prompted this intervention and urges the public to always support hospitals across the country whenever they can.
And this is not the first time these medical items are sent over to Gambia for donations to the various hospitals. In the past, we've donated to the Edward Francis Small Teaching Hospital. And this year, we were wondering if the donation could be shared among other hospitals, for example, the Buyam Hospital and also the Bansang Hospital.
Receiving the items, Dr. Amar Al-Jafar, Chief Medical Officer of the EFSTH, thanked the donors for their benevolence, vowing that the donated materials will be used in the best interest of the patients.
All this issue help us to improve our services and medical services for the patient. You know, our hospital is a major referral hospital in all Gambia. We have a lot of challenges. So when we start to have this support and this issue, maybe it's help us to solve our challenges and our problem.
EFSTH is the largest hospital in the country, originally founded by British colonial administration in 1853. Until 2013, it was known as the Royal Victoria Teaching Hospital. Ansmane Sonyase for QTV News.
Now, the third edition of the Farafenni Senior Secondary School Human Rights Club Summer Training Camp has attracted students from various schools in the region and beyond. Don Williams tells us more.
Every human being has rights, and we need to learn about those rights. A week-long training camp started on Tuesday, 6 September 2022 at the Farafenni Senior Secondary School campus. At the opening ceremony, Mr. Mamadou Ba, a teacher, human rights coordinator of the school and chairman of the program, welcomed participants and guests. He highlights some important topics affecting our societies, such as leadership, sexual and gender-based violence, human trafficking, and peace and conflicts that will be dealt with during the camp.
We are going to look at very important thematic areas. For example, we will deal with leadership skills. You will all agree with me that one of the greatest problems we have in Africa is leadership crisis, leadership problem. Africa is the richest continent on earth, the richest continent beneath the soil, but we are the poorest continent on earth. Why? Because of leadership problem.
Aissatou Bojang Kouyaté, a teacher and coordinator from the Gambia Senior Secondary School, in our address to the students, encouraged them to cooperate, to take something to share what they have learned with others in their respective schools and communities.
This is a summer camp, and what we are expecting is that when you are leaving, you go with something. We are here to add value to your life. So we expect all of you to cooperate and learn, so that when you go back, there are other students in the school. As Mr. Lee rightly said, you are chosen among the lot. So that when you go back, you will be able to disseminate the information you learn from this summer camp to the other students.
Adim Boj and Aissatou Julde Jallo of Gambia Senior Secondary School and Esau Senior Secondary School both spoke of their expectations.
Expectations are they will be training us like leadership skills, beads making, and all those stuff.
I expect to learn many things because last time when I was here, I learned many things about these leadership skills, peace, and this civic.
And Mohamed Janko, president of Gambia Senior Secondary School Human Rights Club and a participant, appealed to students to make use of this opportunity. Other speakers included the Vice Principal, Mr. Drame, Chief Ukunta of Farafenni Senior Secondary School, and Kasim Toure of Esau Senior Secondary School. The Human Rights Club is an international student-led organization dedicated to spreading awareness and education on human rights issues across the world. Don Williams reporting for QTV News from Farafenni.
That's it for the news, but before we go, a recap of our main news headlines. As investigation continues into the cause of the acute kidney injury outbreak in the Gambia that has killed dozens of young children, we spoke to Dr. Abubakar Jah about his views on the situation. Authorities at the Department of Livestock Services and the National Livestock Owners Association have confirmed the outbreak of cattle lumpy skin disease in the country, which has led to the death of some cattle. The Ministry of Trade, through the Enhanced Integrated Framework Secretariat, is hosting a high-level forum for public sector officials on how to access trade-related climate change financing. The Gambia's Minister of Tourism and Culture, Hamad Nkeba, has expressed his disappointment at the $20 airport security fee to be paid by travelers and visitors at the Banjul International Airport. That's it for the news. Join us at 8 p.m. for more news. Thanks for watching.